Hey guys, Dr. Watt from 𝗙𝒂𝒊𝘅 Chiropractic. Let's talk about 3 ways that we adjust patients to help with disc issues. Now the first one that we're going to use here is called a flexion distraction table. Now this is one of the most popular and one of the best ways to adjust the disc. That disc oftentimes is that space between those vertebrae, and we'll see a decreased disc space. Sometimes that's from degeneration, sometimes it's from age, sometimes that's from an injury. And we found that that area there even starts to degenerate at about the age of 18 to 20. Because there's almost no blood flow to that disc anymore. And so this is one of the best ways to open up that joint space, force more fluid into there. So this adjustment here is what's called a flexion distraction table. And so this flexion distraction table, we can stretch the patient out. There's the distraction. And then we've got different levers that we can do to create the flexion part. And so we'll have a hand up here on the low back and start to push the feet down towards the floor. That stretch and that pump there gonna feel fantastic, but what it's gonna do is gonna open up that joint space where it's smushed together and trying to open it up so that we can increase fluid going back into that joint. And so we'll pump through this. These treatments just take a few minutes. And so we'll do a shortened version now, but this is one of the best ways to treat a disc issue. And this works so well. So if we don't do that with patient or we need other ways to adjust them as well, we will supplement that flexion distraction by using drop tables. And so this table is going to pop up underneath the patient. We're going to figure out which vertebra is stuck and subluxated and where they need adjusted. And we're going to have a gentle force down through the floor. Table makes a big boom, but patient feels almost nothing because that force is going through that joint and it has the ability to disperse out, but still lets us put force through the joint. Right? So if you really like physics, this is where we get to get in some fun physics problems. That force going through that joint is going to help that vertebra move again like it's supposed to and like it's made to. The third way that we'll adjust patients' lumbar spine, especially focusing on disc, is going to be what we call side posture. So Christina here is going to lay on her side facing me. Bend this top knee up, kind of like we're putting the patient into a big pretzel. And we're going to find exactly where that vertebra is subluxated, and we're going to adjust that segment specifically. Roll towards me and let that fall again. Good. So just that little bit of force, once again, is going to restore motion through that joint, allowing that disc to start to open back up and heal again. So restoring proper motion, increasing proprioception, and helping your body get through that healing process. Now, all 3 of these are fantastic, but different ones are going to work better for different patients. So if you want to know more about what would work better for you and your condition, come on in. Let's chat about it.